morning and welcome to Daybreak Africa on KAFTAN television. My name is Miracle Odunayo.
And top of the morning to you. You're welcome once again to Daybreak Africa from our studio in Ondo State, which is the sunshine state of the nation. My name is Ikhonede Joshua Odeji.
Good morning.
Good morning. It's a new morning, new day.
New day, yeah.
And a lot of things are actually happening these days and all that. You know, I was recently seeing some posts in the actual sense because it reminded me of a very traumatic stuff that happened over the weekend. You know, we lost over the weekend, like it's almost 2 weeks now. Yeah, 2 weeks now. We lost an elder in church, and he happened to be someone that was very close to me. All of the things that affected him was the fact that he had something that has to do with his prostate issues.
Cancer?
Prostate cancer. Not prostate cancer, I don't know.
Okay.
It wasn't that cancerous.
Okay.
Prostate issues at first.
Okay.
Then he was supposed to go do a surgery. He didn't do his surgery in the right place. He did it in the place of... The doctor was... You know, there are some kind of surgeries that you don't do personally.
You have to involve other specialists.
Involve other specialists and all that. It never involved other specialists.
Oh God.
That was the doctor there. So there was complications.
Oh my God.
And immediately the doctor just referred him to one of the best hospitals in Ondo, the general. And when he was there, the doctor did not go there to see him.
He knows what he
did. And the thing affected this man's kidney. 3 whole weeks at the hospital. And it was a struggle. Okay, well, we spent a lot of money and all that. And sometimes it just took me to this issue of sometimes we need to take our health seriously, in the sense that when it comes to things like health, you need to understand who is in charge of taking care of whatever happens to you. Because at the end of the day, you might any small hero, but it will be like phone.
That you can just repair, swap or do whatever.
You can't swap body.
You don't have extra life anywhere.
So honestly, we just need to be cautious and careful. And all those kind of things. It was a very traumatic experience for many of us and all.
And I think this is should be a word of encouragement to everybody out there. Please, no, not even encouragement, admonition or I beseech you, brethren. This time around, take your health very, very seriously. We know you have to do 2 jobs, 3 jobs to, have income and all of that. Even at that, especially men, you people.
No, honestly, I'm talking about health and all that. Okay, thankfully our guest today actually is going to be bringing us through a lot of things, especially in the area of diabetes and some other health issues and all that, because she's a friend of the house actually though, and she's also running an outreach because of the fact that her birthday is, and the outreach is coming on her birthday itself.
Yeah, exactly.
And which you're going to get to meet our guest, but we need to also do this awareness of the thing. Let's say things raw. Let's say it's the way it is. We can't hide some things from you.
Exactly.
Because the truth is, things are happening.
Things are happening. And you will look at some people, perfect, looking good. You won't even know that
they are dealing with terrible stuff.
Terrible stuffs.
The funny thing about this person was, anyone who saw him a week before that time,
I think he's healthy.
We think he's healthy. They never knew at that time there were robbers already in his body. That was into just a excrete and urinate. And the funny thing is, you meet medical practitioner and will tell you a lot of things are happening. This person is, that person is. I'll be like,
I think it was a medical doctor that was telling me of recent that there is this woman who, luckily for her that day, I think she just went to go and visit someone at the hospital. And okay, let me just check my blood pressure and all of that. To her, she was okay. Coming from where she was coming from, maybe I think a party or a marketplace, then she was admitted.
Straight.
Just imagine she went home without checking that. She would be like, oh, I'm perfect. And if anything happened to her, like for example, God forbid she dies, then the people will say, nothing happened to her, it's a village people, they killed that woman, not knowing that.
Village people say, we'll get back to that. I think we should just take the reports of the day. After the report, we go straight into our discussion. So please stay with us, we'll be right back. Alright, welcome back to the show. If you just joined us, it's still Daybreak Africa, and yes, it's time to go straight into our discussions today. Today, we will be looking into the health perspective of things. I know we've done a lot of politics this week. We've talked about Nigeria's issue. We've talked about everything. Now let's go to health, because at the end of the day, it takes an healthy person to know the future of the country.
Exactly.
So that is the major thing. And today we'll be looking at a lot of things. Though majorly we'll be basing it on diabetes. We're basing it on hepatitis, we're basing it on women's health generally. But then, logically, we'll be looking at this holistically today on Daybreak Africa. And I have a medical practitioner with me in the studio who is a very exciting speaker, someone I'm very excited to also have in the studio with me. She is a medical practitioner, a gynecologist. She's also into obstetrics. I hope I pronounced that right in the actual sense. I've been trying to improve my English for a very long time. Well, Dr. Olajide Oluwatomi is here. Good morning, doctor.
Good morning,
everybody. Always a pleasure to be here.
It's good to have you here again.
Thank you.
Beautiful as usual.
Oh, thank you once
I
again.
won't forget to give
Same
you
goes to you. And same goes to you too.
She took it out of my mouth. I've been teaching her to be
Don't worry, sooner or later.
So I heard about the fact that you're about to go in on an outreach. You're about, trying to do awareness on some health issues and all that. And yeah, for the first time, she's going to be doing even free tests for people on things that has to do with diabetes, hepatitis, and yeah, even family planning. But let's start with diabetes a bit, because I've been trying to know about it, because I've seen families with a lot of family histories.
Yeah.
And there was a time I lost a friend recently. He said his father died. What caused it? He said diabetes. And the father was just in his 40s. But there was another friend of mine, I just remember that this man was in his 80s, and he had been a diabetic patient for close to 40 years.
Wow.
He lived till his 80s. And cool. So, and there are a lot of misconceptions around this whole health issue especially. So I think this won't start from there to a very large extent. First, let's see this issue of diabetes. I think we need a bit of clarity on it. From your perspective, what is diabetes? How does it play out in itself? What's the game strategy?
Okay, as I said, it's always a pleasure to be here. And what is diabetes? As I tell people, there are two unfriendly elements that we have in the African society. One has to do with salt when we start talking about hypertension, and the other has to do with sugar when we talk about diabetes. Now, it's not all about the consumption of excessive sugar that can land you into having diabetes, because we have several kinds of diabetes, and the three major ones that people talk about is one, type 1. Now, type 1 diabetes is the fact that you were born without insulin balance, in the sense that your body is either not making enough insulin, or the insulin receptors are not sensing the insulin the way they should. So instead of them to help you carry sugar into the cells where they can be used for energy, unfortunately the sugar will be in the blood causing havoc.
Wow.
Then we now have the type 2 diabetes, which is based on lifestyle most of the time, when we eat too much burgers, do things that sugar now become excesses in the body to the extent the body's insulin is not sufficient the way and will not stimulate the receptors the way it should. And then instead of sugars going into the cell to do work, it stays in the blood and does havoc. Then the third one, which comes into my field, what we call the gestational diabetes, in which at mostly 20 weeks, that is, pregnancy caused this. Not a woman who had diabetes and is still diabetes in the pregnancy. No, she got pregnant and she now noticed sugar is now excessive in the blood.
Wow.
So that
can happen in pregnancy too?
Yes.
Yay.
Exactly. As I tell people, pregnancy is a very interesting journey. Things that has never happened to you could happen to you, especially for first timers. I told you, we call them primigravida, the first time getting pregnant. Not only are they in trouble with hypertension, they are also in trouble with diabetes. Because the whole body was supposed to create sugar for the baby, but unfortunately, it became too much in the mother. And there are other hormonal factors that we are not in your body are now introduced into the body, and now take similar likings to some hormones in your body and play tricks on you. So pregnancy, as I told you, ain't a disease, but you have to watch it. And that's why I kept on telling you that if you think in the first trimester you are all cool, you now feel all through you'll be okay. Imagine I told you 20 weeks, that's like way into second trimester, almost even going towards the third, and then all of a sudden, voila, you're now diabetic. So those are the three kinds of diabetic, and sugar, I told you, is the issue we're having in this case. I hope that answers what is diabetes.
All right. Yes. But I would like to know the reason why we refer to diabetes as a silent killer in quotes, because everyone, diabetes, oh, you're going to die young, this one, this. I just want to know the reason behind that.
Now, as I told you, diabetes is when there is sugar in the blood doing a lot of havoc, right? Now, There is a time when we're in medical school, they always ask you, what are the complications of diabetes? And then that's when I knew that we can do, not just in church, my head, my shoulder, my knees at all, because Jesus, oh boy, your head, your shoulder, your knees and toes will belong to diabetes. Because it will start from your very own brain. There is something, the sugar level. Yes, your brain depends on sugar. When there is now excessive sugar, I hope you know there is something they call diabetic comatose. You can actually shut down.
Wow.
Yeah, that's
Not
when
low sugar now.
not low, high,
High
sugar.
sugar.
Wow.
Now, low sugar is when you now have hypoglycemia. You know, I always tell people this. With sugar problem, it can either be, I told you it's a disease of balance. When your sugar is balanced, you're okay. But when you have excessive sugar, you have diabetes. And when you have low sugar, you have hypoglycemia. And both situations can actually make you go off. Now, in hypoglycemia, you go off because the body doesn't have energy. So your body will tell you sleep. Just like when you run out of battery, your phone will tell you what? Battery low. No.
Sharp.
The same thing with the human brain. And then in the other hand, in diabetes, it's now becoming a toxic case. And your body too will shut down. Both scenario not good. Now, that is what will happen from the head. Now, if that goes to your eyes, there's something we call diabetic, how I put it, diabetic blindness. That's in the case where you now have retinal problems that are caused by diabetic. We call them retinopathies. And that is from the issue of sugar. You now come down to your heart. I told people that diabetes and hypertension always do a dance together.
Wow.
And you now start having cardiopathies. You now go to your renal system. Yes, that is why it's called the science cleaner. By the time you now recognize, oh, is this what is happening to me? It must have gone to your renal system. Your system is no longer doing what it's supposed to do, which is flushing and filtering. Then you now notice that you now start seeing sugar in your own pee. Yes, that is how we catch them during pregnancy. We do two tests for them, for protein and for sugar. Protein we warn you for preeclampsia and eclampsia, and sugar we warn you for diabetes. And once you're flagged for any of this, we now send you straight to the endocrinologist so that we can co-manage the patient. So that is why it's a science killer, because at some point it even goes to your nerves. That's what we now call diabetic nephropathy, where you kick yourself, you won't know. Then you now notice there is an ulcer that is non-healing. Then you now have a diabetic foot that most time, I told you, at the end of the day is a sad thing. They might get to amputate you because the nerves there are now dead. So your legs will be rotting right in front of your eye. So will you agree with me that it is a silence cleaner? Pink.
Definitely. But looking at the fact that, because you mentioned earlier that diabetes sometimes comes during pregnancy, sometimes is hereditary, and sometimes lifestyle. Let's talk about the lifestyle aspect. What exactly do you think, as human beings, we should try to avoid as much as possible to save us from this diabetes?
Now, when we talk about avoidance, we talk about prevention in medicine, and we have like 3 to 4 levels. The primary levels is what I'm trying to do today, which is the educational aspect. You need to know about this. And that's why I went as far as, let me do a talk show on my birthday, because I was born on World Diabetes Day. The whole drive behind all this.
Wow.
Yes, I'm accepting
That's beautiful.
gifts. So at the end of the day,
Like
at
she said, yes,
least
she's
know
accepting gifts.
and know about it. This is what it can do. Do it first to find out if you fall in that category. Because I told you sometimes it might not be in the family, but you might have given it to yourself based on how you lived your life. Avoid foods that will make you go excessively fat, because hypertension, obesity, and diabetes are 3 good friends that once you don't pay attention to, they will live happily ever after till it gets you to death, because that is their target. That is the primary level, education and awareness. The secondary level is, now I am diabetic, what am I going to do? You now come to the hospital. That is when we now try to treat you. Some people are lucky and very serious. They change their lifestyle, and all of a sudden the sugar level goes down and they are normal again. I'm very serious. Some people are that lucky. While others, after you've done your conservative management, which is reduce your sugar, go for exercise, lose that weight, stop this eating of unnecessary junk food, go for your vegetables, go for fruits that have lesser sugars. I'm talking about your green fruits, that's what I call them. Your cucumbers, your unripe bananas, all those greens. Go for them instead of the reds and browns. So like, what do I mean by brown? I say, have you tried dates?
Oh, but I heard that dates does not have a sugar level.
Yes, but how much of the dates will you go to eat in the name of looking for sugar? Yes, they are friendly sugars.
God.
Yeah, I always tell people this, they are friendly sugars. Some people say, I don't even take sugar at all and I take saccharin. Do you know what saccharin can do to you? Because that is a synthesized substance. I'm very sorry. So I tell people the more natural, the better. Do the right thing. Go for your green fruits. Go for the less sugary ones. Some people have a sweet tooth. They always want the watermelons, the sweet pineapples, the sweet bananas, and then they run into trouble. So I tell them diet plays a key role. Yes!
Watermelon. My
Watermelon.
favorite.
Some will still sprinkle sugar on it. I make up with soup. It's not every day I get to do that. But serious, have you tried? Put it inside the refrigerator, that cool temperature. Before you know, you become an addict. Before you know, it might do you something bad. So we now tell you all this. That's the second level. Then the third level is the bye-bye level, in which is now a comorbidity. I'm talking about the retinopathies now that we can't reverse. I'm talking about the renal disease that might lead to dialysis. I'm talking about I'm sorry, all you can do is to make you as comfortable till you die.
The fourth stage.
So the fourth stage, as I said, will focus more on research, in which we'll go back into how many people have died of this. How can the community doctors talk about this and bring about a positive impact into the society, in that from the primary level, that's the level 1, all the way to 3, revised and restructures to bring out better outcome for the next round. So that is the best thing I can tell you. You pay attention to your family history, your diet, you go for tests, you go for early, as I always tell people, the earlier you know, the better the outcome. Then if worse has come to us, we go into the palliative care, which is to give you a quick and happier death, and of course the research.
Quick and happier death. One of the things that thrills me the most is when you were talking about foods, especially, because I think I want to talk sugar particularly. We're talking about consumables, things that we eat. And I know recently Nigerians were so skeptical about this issue of GMOs and all those kind of things, which I was still saying I was going to even do a research on, or even bring someone over to discuss it with us. But then I discovered that a bulk of the things you talked about, the green vegetables, the sweetenings and all those kind of things. Let's even start from sweeteners. 88% of the foods of Nigerians today, if they are not carbs, they are the sweeteners. In fact, if I go on a date with somebody that say, go take a cucumber on date, they won't be happy. But unless I give them the very sweets, you know, and all that. And so people, their lifestyle is
revolves
around the sweets and very sugary things, because it's you know, and there's a level of sugar these days that is extremely addictive. Honestly, no one likes anything that is bitter. When last did we take a move? So the truth is, how do we go about this? Because when you talk about bananas, one of the things why I shouted was, it's one of my is my favorite. I eat it almost. I can eat it in my dream.
Mine is watermelon too.
Perfect.
Yeah.
So
those are the only two foods me I eat. Watermelon, banana. After the deal, I don't know how to go about the rest like this.
Now you see, I actually tried my best to like tell people this. One thing I appreciate about my parents was this: they ensured that all the foods and the classes of foods were always made available at home. So you won't just be looking towards, I'm going to take sweets today. No, there'll be a time you'll be like, okay, let me start with asking for forgiveness. I grew up in Jos Plateau State. Food.
Yeah, we know.
Food, glorious. Food grows there. So all the way you talk about vegetables, you're talking about your fresh tomato. In fact, everybody boasts of UTC. In short, tomato juice, they call you that, you know you're a fine thing. We have all sorts of foods growing there. So the curiosity of how to eat and eat balanced was not an issue in Plateau State. But now if you go back into the far north, places like Kano, places like KB and the rest, where you know you're encroaching the deserts, you don't have luxury of certain foods there per se. So they actually fall back on things that are made available. So we're talking about grains. During the rainy season, they harvest their grains perfectly. And why not corn, which is not a strange thing to anybody in Nigeria? So sadly, the foods that are made very available to the average Nigeria are mostly carbohydrates. So now it is left for us to educate ourselves. And that's why when you come towards the West, where we have more leafy things, you see us making crazy foods like a wedu,
Ah.
you put one big cow leg
cow leg.
inside, you put your egusi, you cover it with palm oil, and there you go, your protein, your oils, your vegetable, a balanced diet just in your soup. Then you swallow. But you go back up north. Some people will just make kamu, which is pap. And it's a surprise that's what they'll take all throughout the day. Next thing you see a child with a protruding belly and a slim hand, kwashiorkor looking back at you, and there's nothing you can do about it because that is what is available. And then you go towards the other north where they raise the cattle, and all they take is milk, milk, milk. So you see a very flat tummy, but a thin body because there's no muscle to build. But there's enough protein to just give him that slim, good fit. And I was wondering, I say maybe it was the lifestyle that made the Fulani the tall, beautiful glass of water as we see. Slim, strong enough to go around to chase their cattle. Well diet enough because carbohydrate is the least you see in their diet. They go for proteins. So if you think you can outrun an average Fulani, think
You're
again.
joking. You are joking, literally.
But you that have eaten all the pounded yam, the
Well, where you want to go, bro?
then you now go and eat it in, God gave you the balance, then you now go and eat it in excess. And then people will not tell you the pot belly is a sign of good life.
living.
That is
No,
it.
no, and they will say to you, but they will say, the one who cool, I'm a boo.
Oh, that is the quickest way to the graveyard, my brother. Excessive weight that will lead to diabetes through obesity.
Wow. Wow.
So a lot to think about.
A lot to think about. A lot to think about.
In fact, it's getting me scared. Like, it's getting me, no, literally scared because honestly, well, normally, excess, let me say abundance sometimes leads to abuse to a very large extent. That's one of the things people don't actually know. Abundance leads to abuse and all that, and many people don't know about these things. It's good that many people are trying to get to know about this to a very large extent, even though they've been telling us all those things all the time. But then there's still something I always sometimes ask to some. There's this conflicting issues, especially when it comes to dieting and medicine, especially in this part of the world. You never know what is true. Because this person can come to you today. So like me that grew up in a place like Lagos with people that just comes on the bus, social the bus, and begin to tell you things that don't follow. And they will tell you, it's not necessary. The reason is, then they will tell you one thing today, your doctor tells you something else tomorrow, they'll tell you another thing next year. And there's now an influx of products in the market, whereby they don't have NAFDAC number. But they will tell you it is healthy. It's healthy for your dose. They'll say some will call it milkshake, some will call it, I've forgotten, Pravate, and all those kind of things. And there is a lot of it on the market today. And you'll be like, you're telling me this thing is healthy now. You're telling me this thing will do this for me, do that for me. And to a very large extent, from what you've said now, a lot of these things are infused in this. Someone said, well, ignorance is a very lucrative industry and all that. And many won't want you to be
intelligent
smart
enough.
enough and all that, because they know when you are smart, you won't actually buy their products. So how do we cope with this? Because it seems as if, especially if we talk about government here, they just left us fallow to just take anything for ourselves and kill ourselves the way we want to do.
Well, as I told people yesterday when I was having a long talk, I was like, let's pity government now. When they bonus, government no day hospital.
Sure.
When our parents went to the altar, government did not necessarily. All you wanted is that they should register so that in case any of you want meant, you could fit solve your issue. Let's be truthful to ourselves. If I give you a live scorpion, all venomous and all, there's some scorpion you can't eat.
Yeah, true.
The venomous one, and you are aware is the venomous one, would you eat it?
Never.
So I asked people, why would you, on God's green earth, with you having his spirit inside you, they say God breathed on top of all of us, would you see something with that NAFDAC number, which is meant to tell you, we have tested and tried this thing, so it is safe for you to take. Go see him. Forgive me, I have to go broken so everybody go understand this part. You go see, say, number, we go tell you, say, this is no good because if you take them, you there on your own. I go school drink. In simple words, you they meant.
No, that's a very sincere question.
So I tell people this. Yes, it's at your own detriment that I even go to the hospital. Why did I use that word? Some hospitals are not hospitals. And that's why the government go around every year to find out quacks, to close down some places, because God knows the advice they've given some people. And how did they track them if not from the results they were seeing in the society? You can imagine a bunch of people saying, Joshua's hospital, 10 people don't die for inside there. And I said, let us go and investigate Joshua. Lo and behold, Joshua no be even doctor. He buy certificates. So I tell people, even the ones that call themselves doctors, are you sure you went to the right one? What do I mean like that? We have specialists.
True.
An orthopedic doctor has no business doing a CS, except maybe it's an emergency because he was a house officer, and of course maybe he carried out CS.
Yes, yeah, true. Don't regret.
But he will never go and say, I am a bona fide gynecologist, because he's an orthopedic doctor. And me have no business putting nails in your bones. It's not my job. If anything happens, you're on your own, because that's not my area of specialization. But I'm still a doctor. So I always tell people this. Always go to a doctor, because when he pass a doctor's power, guess what they'll do? Will refer.
Because
So from your GOPD, yes, your GOPD will see all sorts of things. But when you say, oh boy, I don't give drugs, this thing don't pass my power, kindly see a specialist. They'll write a letter for you. So that means even in doctors, we have specialization. And inside specialization, we have cadre. I'm a registrar, hopefully hoping to become a consultant someday. And even as a consultant, he's hoping to become a professor someday. So those people are put up. So what he's showing is their years of practice. They can tell me, see doctor, if you put your hand inside here, I wish you luck. Why will he tell me that? Because of course he has seen it. So I tell people this. You will hear all sorts of things. Even Jesus himself said people will call him Lord, Lord, and what will happen? They're not going to enter heaven. You get why?
Because they actually have their hanky-pankies and things they've done
So
already.
please always go for the short thing. As they say, follow who?
No road.
No road.
Full stop.
That's very important. But before we move on with the other discussion, right now we have to go for Go Start, and it's time for us to learn and unlearn again. So guys, stay with us. We'll be right back.
Alright, welcome back to the show. If you're just still Daybreak Africa, and yes, I hope you enjoyed Go Start. I hope you learned one or two things from Go Start. But now it's time to return straight to our discussion. And we'll be looking at a bit of health talk. We've been talking with Dr. Oluwatomi, and she has been putting us into different perspectives. Why with diabetes? I don't know. I've been scared since, because honestly, even the joke is not joking. Because it's
You don't have to be scared.
because not that I don't have to be scared. I think I have some histories in my family of those that really had it at a particular time and thereabout. And when she was talking about the place of hypertension, diabetes, and what other disease again was that?
Obesity,
Obesity. They
overweight.
play together and all those kind of things. So I was just looking around me and like, check. And though I'm very grateful of the fact that at least there are some lifestyles I just intended to cut down and go. Something like alcoholism. You just have to we can't be taking beer.
But the thing is, speaking about family history, sorry to cut you, I would like you to talk about this part, because most times you just say that somebody died in your family. What happened? We don't know.
We don't know.
They won't tell
Even
us.
they don't know what happened in the actual senses. Unless if you
Some
know.
of the family, they will know, but they will not say it. So you won't even know what is going on in your family. You won't know the kind of
secrecy
sickness that is going on in that family. Please, as a medical practitioner, just talk more about that part of families keeping or hiding away disease or illness away from people.
Some will even put Christianity there, and
Yes.
they say, I reject it in Jesus' name.
reject it.
One nepe.
As I said, I always like to address this issue a lot, because I tell people, I like your paranoia, because even in the Bible, Luke, I told you, my G, God bless you, he was the one that inspired me to be a medical doctor, because
Wow,
Luke was a
Dr.
medical
Luke.
doctor.
Yeah.
And I tell people this,
Legend.
what better way to shame the devil by to call him by his name? I told you a million things can cause a headache, can cause a fever. But imagine saying meningitis. As I take this drug, please I send you back to who sends me. I beg, pass through the villagers before you go to hell. Sadikawi.
We also go with you.
So I tell people, it is not a crime at all for you to call certain truths. And this includes a very important, vital part in clerking. Now, clerking is doctors being police. I mean it, the serious inner light thing. Oh boy, it starts from what is your name? You be taking in a fight, what is your name? How old are you? All those things have very crucial importance, because I will not treat a 5-year-old the way I'll treat a 25-year-old. Because a 5-year-old is in the pediatric population, and everything that concerns a child, if you don't take the weight, believe me, you fail that exam. Because they'll ask you, what is the dosage of this drug? Because you base treatment on weight for children. That's why you see per kg for children. Why an adult, once you are above 60 kg, take the same thing. No difference. So, age, as it is very important. Then in our classing, there is something we call family history. We're not dumb, because there are things that are what? Hereditary. So I like the fact that we had a very good talk one day as regards tests you should do before you get married. And I told you that it doesn't just stop at your average hepatitis B, C, your genotype, your blood group. You should go as far as investigating such family for. I told you illnesses. Now diabetes is one of them. Hypertension is one of them. I told you there's something that I believe Nigeria are downplaying, because not only will it just start as a cough and catarrh, as I told you, there is something we call the Cartagena syndrome, which came as a cough and catarrh. But when we told the guy, go and do further tests, we now found out that he was impotent. I was like, see, there's a link. The mucous membrane is not cleared out of your body because the ciliary movement I told you of the cells were not good. So that same scenario that takes sperm from the ball sacks to the storage house. So it's a symptom. So if you don't ask people simple questions, have you done your genotype? Is there this infertility in your family? Is there this? Even to the extent people ask of Wiri, let's all tell the truth. Yes, is there any mental illness?
Yes.
See how you are nodding, because those are the ones that nobody wants, Abby. How about the hidden ones that the woman will be silently blamed for? Now you can imagine someone just having cough and catarrh and you thought, it was the woman's fault, until they did heaven and earth. To the extent a woman that is non-medical knew what CoQ10, I thought it was so embarrassing was. That's one of the last options we give women, because we want to stimulate their eggs and stuff well. But now everybody is now using the drug like it's chewing gum. Then what else do you want us to do for you? The abuse of it. So that's why I tell people, the moment you know things from the basics. My family, we get epilepsy. Okay, my own don't have. Are you still going to marry me? Yes. So that means...
Me, I know it, I agree.
Exactly. Yes. So that means, at the end of the day, we'll see a neurologist just for the kids. Okay. Solution, or I get epilepsy. Last we go last. And some of them will now make it to the hospital. That was a funny case today. We all laugh at me, my house officer, and some of the nurses there. This woman, when we were asking, do you have this? No, do you have that? No. Went into the labor ward, and all of a sudden, she's there convulsing. Yes. And all of us first looked at each other before we now sprang into action. Do you know why we looked at each other? We asked. You said, like you said, you know what she said? Every time I said, do you have hypertension over her dead body?
Hey.
You this one, Olaruma, what how they put it? What for? Because Olaruma, do you have this one? This is how I'll be looking at people right in front of us, because I told you, pregnancy is a funny thing. It will just manifest things that
you've never. Even with very hidden things.
So at the end of the day, when we finished, we now looked at her. She now, guess the funny part. Emma, you know now, these are the kind of things we do. I said we chased everybody out so that you could tell the truth.
You don't.
I had to take. I had to take her folder and show. What did you read here? You can read it. It's in capital letter. Read it. She said confidential. I have no rights, except maybe in the court of law, for me to talk about you with your name and your picture.
Which is not supposed to be.
So imagine that I was that quack of a doctor. All of us are shaking us to ride down between all of us we converse that day now. Because most people, quacks mostly go for the easy ones. It's when they now run into trouble, they now refer you. Yeah, that's what people don't know about quacks. And you glorify them because they know the easy ones. She's big, her pelvis good, she go born. Go carry small pelvic woman and put inside your shop now. If they born you well. Those are the ones they'll tell you, no, go to clinic. By the side, they'll tell you, that is not something they see in your blood, go to clinic. Now lie, they don't collect the money where they want. Send you go the replace. I tell people, follow who know road. Thank God that is now everybody saying. Do yourself a favor, do your assignments, go for tests, talk to a doctor. Talk to a doctor friend, make a doctor friend that is one in your community. Even if you see the doctor once in a while to come and see you, trick your doctor, tell them come for dinner. Then say, hey doctor, there is this. They will know when they will start blabbing, because let me tell you, the average truth of a normal doctor is that I'm very serious. Money is not the first thing on our mind. There is this conscience that I think we already have because we don't have a choice. In that same hospital, you look at the time of death, you write it down. Next thing, welcome. So we've seen life come and we've seen it go. So what is the gain if not to help?
Doctor are gatekeepers. They've seen the go and the come.
And yet we're on strike because of the pills.
Money will come. Don't jack up.
No. I say one day I pray no go jam Bavalo for inside hospital, because then go be there on ground and they go just take over management. So come, brother, go to the room. Oracle 1 is waiting for you. If you know Oracle 2 is on the other side. I pray we don't get there.
So we mixed a part of this discussion a bit on the place of the things to look out for that should make one begin to take cognizance of your health in line with diabetes especially. You know, immediately, like someone like me, okay, let me just bring this to the open. My dad had diabetes to a large extent, though, and one of the things that caught me immediately was, check down through the lifestyle. I have to cut down, so I'll cut down on that. Though I've never done a test till today to check for my sugar levels or so. I get this thing, but then I just have to just know that I can't do this, I can't do that. If I took exercise and football extremely serious that period, yeah, just the sweat, just the fun, the sweat they go. But then, at the point, what sign should one begin to just know? It's getting like as if what sign should we look out for in that particular aspect?
So I'm going to explain this on 3 levels. I'm going to explain it to you on the medical levels, where you go and say this, and when we clock and take our history, and then the one as normal patients, and then back in the ancient days. So as a medical doctor, we normally ask for 3 P's. One is the polyphagia, meaning do you eat a lot and at the end of the day there's no evidence of it, meaning you're still like slim.
Yeah.
Do you drink a lot, meaning for no good reason you just feel thirsty and you keep on taking water? And the reason why you do that is that you want to actually dilute the sugar in your blood. Then the next question is, do you pee a lot? Because when you drink a lot of water, you're definitely going to pee. And then if I go down into the urology aspect, which is the male urinary system specialist, they will always ask this question: do you excessively pee at night? Because it's that night period that will determine if you're tilting towards the diabetic kind of patient. Then for general patients, what should you look out for? I always go for excessive sweating. For no good reason you find yourself sweating, that's a sign of hypoglycemia, meaning at the end of the day, your body has used the little sugar it has, and then you start sweating out, because you first become hyper before you become hypo. The next thing I ask my people is that, do you get unnecessarily tired? Do you see blurry visions? Because I told you that part of diabetic symptoms or complications are the nephropathy. And then you now see some people becoming all puffed up with swollen eyes. That is the kidney calling out for you. And I told you that part of the organs the diabetes likely go for are the kidneys, when you now have a nephropathy. So we always tell them to go and check that. And as I told you already, it can affect the brain. So if you start seeing yourself not paying attention in class, unnecessary lack of concentration, we always tell people to do that. Then for our pregnant women, I always tell them, as you're eating plenty, they will say you're eating for you and your baby, please do a diabetic test too, because that could also be a sign. And I'll now go down to the ancient of these. As I tell people, we normally pee outside. So the question they normally ask is, if you throw sugar on the floor, what do you think we gather? Ants. The same thing. There is sugar in your urine. So if you go outside and pee and all of a sudden you're seeing ants doing a group meeting there of, there is food, that was a clear sign to tell you that there is a lot of sugar in your blood and now in your pee. So those are the signs you can see as an average person to go to the doctor for help.
Alright, so let's just talk about how to manage it. So let me just say, let me put it this way. What are those common mistakes that people, like patients of diabetes, usually make? Because they feel like, okay, it's sugar, then they will stop eating sugar drastically. They'll start taking bitter leaf, self-medication and all of that. So what are those common mistakes to make while treating diabetes?
Like I tell some people this, I don't have a single problem with conservation method of treatment. In fact, that is the first line of treatment we'll do. We'll try and modify your lifestyle. If that doesn't work, we go for drugs. If that doesn't work, we now opt for surgeries. Now, I tell people this. You need what to do work? You need energy to do work. So the energy your body uses is sugar. But when it now becomes excessive, I told you it becomes a problem, which is diabetes. And when it becomes too low, it becomes a problem, which is hypertension. Hypoglycemia, sorry. Now people tilt towards, funny enough, hypoglycemia. Because all of a sudden, you see someone who was taking 10 bottles of Coke, now they now tell you, congratulations, you have diabetes. He now takes no Coke. Your body will demand that Coke from you to even off you. So you don't just go from no Coke, from 10 Coke to no Coke. You go to as low as 8 Coke, 5, 3,
Gradual.
1. And do you know why I stopped at 1? Your body needs sugar, but you have to put it on what? On a balanced level. Because when you don't have that sugar, I told you, even there is what? Hypoglycemia, which will make you even faint. And then that same sugar you're running from, we will put it inside your body. In fact,
restore you back.
I now tell some people this, as a diabetic patient, that they should always have candies. It sounds ridiculous, right? Around their bedside. Because funny enough, when their drugs work well, sometimes that prescription we give them becomes too much for them. So they go to hypoglycemia. So at the end of the day, to get the sugar to a good level, they will just take maybe half bottle of Coke or take some candies and run back to the hospital. Then we observe them again and find out, oh, your medication now has worked so much, it's now becoming too much for you. Let's reduce it.
So the whole thing is just balancing.
It's balanced. It's just like how I tell people, it's as crazy as how you drive a car. When you see, say the car, they run too much, what you go press? You go match brake. And when you now see that, oh boy, they seem too they slow, you press your acceleration. The same thing with the sugar. When you've gone down the hill, you take some candy. And when you're done with the candy, you remove it back and take your normal medication. If you notice you're still tilting too much, you need to take acceleration. We reduce the dosage for you. But if we are giving you some drugs and you find out that you're still not reducing it, getting the levels we want, we increase the dosage for you until you now need the balanced level. So that is something an average person, I'm sorry to say, cannot do. There are specialists that handle this. They are called endocrinologists. I'm mentioning it here for people to know that it's not just even any doctor you just see.
So they are specialists,
in that aspect,
endocrinologists.
For that, and they will handle that for you. Please, self-medication should be the crime. I always tell people that should be the crime, not expensive drugs. Because some drugs are expensive for a reason. They are branded drugs. It's just like how you have, I don't know whether I remember this green dog soap we had as children and the Zap we have now that is well scented. Dog soap was like the only thing you can go to when you don't have money to wash your clothes. While we now had Ariel that they will sell you. I even remember the adverts. Put a little handful of Ariel and make your bubbles. I don't remember like, oh, they sell and everything. We wash your clothes and 10 people can smell you from miles away because
it's very conk.
Oh my God. So the same thing with drugs. There are drugs, like when I talking now, I'm sure some pharmacists will start rubbing their belly. There is ceftriaxone, you have your Ocephine, and then you have your Rocephin. Rocephin is so expensive. You might be saying, why is that drug expensive? Just try one. Our patients come back and say, we should have told them. I say, okay, do you think I want you to say go and buy something 20 naira one valve, when with that 20,000 you can buy like 6 or 7 of the others? We only use those drugs when there is a need to, so that your body will not even create resistance to them. So when we now tell them, see, sorry, this is not the work, we need to buy branded drugs. Then we start calling things like meropenem. It's like you've heard about that drug. It is very expensive, but it works. So I tell people this: it is not expensive drugs that is a problem. To me, it's self-medication. Because some people go and start using meropenem because they've had it works. Then when you know what do you want us to do?
And you can be specific sometimes and things like that, because everybody has their.
Please and please see a doctor first. You get why. And as I always say, follow who knows.
Who knows. But anyways, before we just round off the show on this particular segment, I would just want you to give, as a medical practitioner now, just give words of encouragement to people out there who are patients of diabetes, who are feeling discouraged, or who are feeling like, oh, that is the end of my life, or whatsoever.
In fact, I want to even ask before that, is it an early killer? Can you live with it all your life? Because you talked about children who have it.
That's very tender age.
Children that goes to urinate sometimes, and then So that is at tender ages too, they can have it. Does that mean it's a total death sentence? You won't live that long or something?
And like I always tell my patients, life and death actually lies in the hands of the maker. But there is one thing we know from our practice, is that the earlier you find out a culprit, a cause of something, and you start to treat it, the likelihood of the outcome to be better is much higher. Take for example, you found out you are diabetic as a child. Instead of you waiting till maybe your teenagehood, where they'll now say before you enter JS1 you must do tests, and you now discover it. The question you're likely to ask yourself is, what damage has been done in that child's body? But imagine that your mother was a nurse and she's like, let's just go and find out why Junior is still peeing on bed, and you do the test for Junior at a younger age of, let's say, 2, 3, and you start giving him the drugs. The drug is likely to start working for him for good, because around that tender age, he will know the dosage, he will know the signs, he will know what not to do, and he might tend to even need a healthier life. So that's why we are always keen on the earlier you find out, the better the outcome. And I always tell people this: never you look at something you discover out yourself as a death sentence. There are plenty things I tell people. Most of the reason behind anything in the medical books is, first off, as I told you, we don't know, but this is what we think. So what we might be thinking is the cause of yours might be one of those we don't know that might decide want to correct itself, and along the line you find out you don't even need to take the drugs again. As I told you, it's just like you driving a car. You find out that you're speeding too much, you step the brakes. You find out you're moving too slow, you let go of the brakes and you press your acceleration. Some people are lucky that they do the right thing just with changing diet, and they go scot-free. Adding a little bit of exercise and they are okay. And I always tell people this: tell me who lived longer in this story. A healthy woman hustling and bustling, and then a woman with cancer. The cancer woman go for her chemotherapy. The healthy bossy woman forgot to look right and she crossed the road. Who died first? I'm happy that made you laugh. So don't always look at it as you might die first. I should write my will. Everybody last go write their will. Everybody last go
have something to give out.
Everybody last will get their final home. I was even telling somebody, maybe I'll go and invest in coffee business, because that is something I told people this: if you invest your businesses, this is a free business advice, under the 7 characteristics of living things, you tend to do well. Nutrition, open a restaurant, man must eat. Irritability, man must go for spa and tourism.
Sure.
Growth, oh boy, still invest in food. Reproductive system, right? That is where I come in. All gynecologists will survive because people must born.
Definitely. Because
so that's why I went for medicine, and I told you it's not about the money, but I'm sure I will make money. Then respiratory system, go and find out how much your free oxygen both of us are breathing in and out. Go price a tank. Go. Just take time. Now that we're on strike, people go get your time. Just go for it. So how much is a cylinder? The last time I had is that the cylinder was 14,000, and it might last you a couple of hours. So you should thank God when you wake up for the air you're breathing free, because by the time you start buying it. Okay. Then death. That's the D of Ninja D, where I'm going to. All of us are definitely going to go back to our maker. Now, the manner in which you enjoyed your life on earth will determine how you're going to go to the other side. Because believe me, if you didn't live your life serving others, because a secret in the Bible, if you want to be great in God's kingdom, you should learn to be what?
A servant.
No, you should learn to be the king. Okay?
Hello.
Serve others. So by serving others, Jesus gave us a secret. In order for you to love your neighbor, you must learn to love yourself. So by loving yourself, you find yourself naturally wanting to do things for people, because you have so much that you don't have a choice than to dish out. I told you, this is what my birthday cake is every year. It's the World Diabetes Day on my birthday, the 14th of November. So I started as a biochemist by pricking people's fingers to do the test to find out if they were diabetic or not. and I graduated to become a medical doctor, how won't I feel happy doing outreaches? Of my dream is not until I start driving that Hummer Jeep. It's not until, it's what I can do now, because I don't know what tomorrow is going to bring. That satisfaction, that everyday lifestyle, that's where I'm heading, that makes you happy, because the cheapest and the freest and the most effective medicine is actually free. It's written also in the Bible. I wish I could find it in the Quran. The Bible says a joyful heart is what? It's good medicine. That is the only good medicine I've seen so far. Other medicine, they will write it small, the side effects can give you headache, and so you no go see am, so you go see buy the drug. Because if you see wetin if you do, aside wetin you work your buy one get 5 free. Get free.
Get 4.
You know go do am. So at least that is one medicine I found out, and it's part of therapy. Your psychiatrist will tell you. I like the way Hausa tell it, because yesterday I was laughing with someone. I told someone go and drink wind. He was like, what is that? I said in Hausa, it means take a sha iska. Wind means actually go and take a fresh break. Take fresh air. Go and take a break. So when I say go drink air, the person was laughing. So I had to literally tell him that. I was like, now so shy is casting, meaning I just want to relax and enjoy the breeze and the fresh air. That is great therapy right there. You know, I was teasing you that maybe on Thursday, before the last mad day, before the outreach, I'll just switch off my phone just to go and drink air. And you are looking at me. That was what I was referring to. Just giving yourself a break. Appreciating yourself. Resting. That is one of the top secrets of most problems, because in case they ask us to write exam, what are the causes of these things? When you say stress and alcohol, you're mostly likely to be right. Stress, alcohol, and smoking. If you don't know anything, talk Adam, you're likely to be right. Let's stay stressless.
But some will say that stress is good though.
Exactly.
As I said, on the 7th day, God did what?
Rest, yes.
No, he entered bush. Now that day he say he wants your bush meat. No go rest.
But I see you adding things like hepatitis. In fact, it's something that I wanted to talk about in the actual sense, hepatitis especially, which I haven't heard someone say is a crazier killer than even HIV/AIDS and all that. And you know, it has levels too. But just briefly, what's your comment on it? Because a lot of people are talking about that in this generation now. You hardly find 10 people walking, and 2 or 3 of them don't really have issues with it too. So
now, I'm happy you said briefly. I think you should actually dedicate another topic to that, because hepatitis is. Do you know when you serve? I don't know, sadly in Nigeria, we are full of, you cook, you pour everything for top tray, everybody go sit down shop. But out there, they'll tell you, what do you want for dessert? Then they will now tell you, what do you want as your main course? Now when we talk about dessert, is that little thing that keeps you busy before the main food come. Now let's look at headache as dessert. Now main courses are things like hepatitis, our retrovirus, which is the HIV, the diabetes, the hypertension. Those are main causes. You can't just decide to just say, let me just... it's a long and a big thing to talk about. But let me see if I can make hepatitis a dessert or an appetizer, because that is a very big thing. So in short words, what is hepatitis? Anything that ends with itis means inflammation. So hepatitis is inflammation of the what? Of the liver.
wow.
Now, what causes the liver to be inflamed can be so many things, but the hepatitis virus is one of those things. That's why I told you that's a very big topic, because we have different types, and the ones people are more scared about is the hepatitis B and C. But we do have A and D and E, and they are all out there in the society, only that some are not as notorious as B and C, and that's why everybody's eye is focused on them. And why do people say they are notorious is this: unlike the HIV that you actually need bodily contact, you have to have sex, you have to kiss, your blood transfusion things, all those things that are actually physical. Things like your sweat. Yes. I like the way Josh always open his heart when he sees something.
When
I said this, sweat. I just remember you can just moving anyway.
You hug people. You hug. You shake. Exactly.
Jesus.
You shake. You go to your friend's house. You drop on their mattress and their bed. You rub their furniture.
I don't get a lot of people like
and
Sunday service.
And why I tell people this, The scary part about this is that unlike your HIV virus, which everybody laugh about, you know his nickname in the medical world, the lazy virus. It easily dies out. And hepatitis is that brother that sticks closer than a friend. No, sorry, it's that friend that sticks closer than a brother. He wants to be around. He wants to be with you. He wants to be the only thing. You know this song every time. All I think about is you. I'm sure that's what hepatitis sing.
So that means most people just carry that thing all about.
Now the sad thing about hepatitis is
Wow.
this. As I told you, it is not a lazy virus like his brother, HIV. And the thing is that it's involved with almost every body fluid, unlike HIV that wants to work hard to be with the inside, pouring inside, the inside, and everybody tell you that lots of saliva to give someone HIV. Well, your hepatitis virus and your
Just
human
need a
papillary virus, they play a different kind of game. If HIV is playing chess, which is slow and a thinking game, they play card, take enter general market. That is hepatitis for you.
Wow.
It's out there. It's something that a mother can give her child easily, I bet. It's something a husband can give his wife just in the name of, let me just have sex with you without a condom or even with a condom, because I told you it's not just body fluid, it's touch, it's your sweat.
Even kissing.
Thank you. That's that press up he's doing on you while he's sweating on you. It is the spoon you're sharing. All people don't care when it comes to hair. You know they always say you can share spoons with people with HIV, because I told you need like 10 gallons of saliva to get HIV according to research, while your hepatitis is just God, why am I so evil? people they behind the camera are not scared of me, but I tell people this by the time you give out the health talks, and that's why I challenge my community health doctors, my family doctors, because they get to see people of different ages. And the community health doctors are the ones that actually do the research. They left the clinic setting to go into the community to find out what is really going on. So I always tell them, see, the challenge about awareness is the beginning of half solving the problem. Because when people know certain things, believe me, they wouldn't do certain things. Except if not devil they truly be. Because as I tell people, some people they come out from banana tree, we still don't believe them. Some people don't get mother and father, they come out from water, blue. Some come out from banana tree, hey. So for
And they think they're living life.
They live life, and only God will know anything they carry from water corn and stuff like that. We are Africans, let's tell the truth. But for every family that has a family, a father will see something that is not good, and believe me, you will not want to give it to his children. That is why we are testifying today about many children who are now having HIV positive mom and dad, and they are negative. That's a testimony. And then now we are having people that are hepatitis positive hiding truths and infecting their children. And the next thing you now find out, that fine boy, he was just 5 years old, all of a sudden his head swelling and he died. His villagers, we are innocent on that one. And that's why I tell the last discussion I had, I said I used to thank Satan on the daily. And people are like, why? I say, because I have somebody to blame. I just did something. Exactly. It's the devil. God bless you, devil and villagers, for giving me something to say when I have nothing to say for my stupidity and etc. Because there are things that their villagers will be like, that day I even get headache. And then we'll be like, say I tell you, say some people go customize health for them because boy, the fire already my own too small. You could need to increase some people's own and increase them.
And some is their personal foolishness that led them to that.
Because I always tell people this. I told her people are afraid of pregnancy tests. DNA test don't come. Or when you're I tell people this, there are some little things that you can solve. Like, it will surprise you, the man that you want to marry is impotent, and all of a sudden you're telling me, see, I just got pregnant. You'll be like, keep quiet, no louder now, picking. Because sister or boy, they shoot blanks. And people might live happily ever after. Because you told the truth. I told her a woman would be scared. I'm pregnant. And meanwhile, her husband is like, go get this girl pregnant again now. And then people meet a truce. There are some truths that you tell that will set you free. And there are some that will hide, that will be your grave. And people will gather at your grave right and drop your flowers because of simple things that you cannot see. You could go tell God and the angels up in heaven. Maybe that's how you like it.
This is where.
Go for checkups. See, I told you people, it's not like a marketing hospital or anything. There are some things that you think are this big, and in our eyes is So is that a problem? I told someone, my husband is SS and me I'm SS. I hid it. La 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 la. I said, do you know there is something we call bone marrow transplants that is happening right now in India that they can just help somebody's son's life? Did you tell your doctors? So there's a lot of talking, a lot of sit downs. I told her one thing I like about your shows is that I want us to talk those dirty talks that people want to bury.
We don't even need to bury things because when you bury things, you
No, I told you, now look at a woman. We chased everybody. Tell us your history. I am not this. God forbid. And then you now start displaying in front of all of us. Imagine, imagine you met a quack. All of us, we just, me too, I'm not, I lose my license, I'll be like, she don't wake up. All of us, we got there. So let us I tell people, you think I'm religious. I told you I just have the fear of God because if you bring me Muslim style, I will go with you. If you bring pagan style to surprise you, I'll jump higher. If you bring Christian style, I will go Bible for you. Tell the truth is what all those great books have said. And in everything, there is always a solution.
always
the question is, where and how far have you gone? So find them.
Then who did you ask? You're asking the right
Simple
person.
question.
Do you ask the right person?
The right person.
And you didn't meet the right person.
I was even thinking that this thing itself, though we can't take any more now because the time is fast spent already and all that. And but then even this outreaches, this awareness of a thing, we need to even take it to churches. We need to take it to
much
mosques
higher.
and all that, because I think religious bodies sometimes contribute
Exactly.
heavily to how people refuse to just be truthful. I don't know
Have
how
Have faith. I believe in miracles. Of course, I'm a miracle, but
Take
there's
your
some
Panadol
things
and have
that yes, but I know that there's some things that you just have to follow the right
the right
procedure.
procedure. Faith does not deny the mountain. It moves the mountain.
Exactly. I tell people this. Let us go back into the Bible because it's mostly the Christian brothers and sisters I have problem with. Don't you have faith? Just stop the drug and pray to God. I say, hey, okay, no problem.
Like my word, God will tell you.
I'll wait for you. That's abdomen that is just like 200 naira, 300 naira. By the time you can't sleep for my free hotel, you know hospital and hotel, you go pay money. You go come lie down for bed, make new friends, watch TV, join, your eye go clear. That 200 naira where you refuse, they pray. You will meet me. By the time you pay 20,000, which is times 10 abi, your eye go clear. You will sit down and talk to you one-on-one. So I tell people this. This is how I try to even convince some of the Christian ones. I say, amen is done, ma. So it is done has now come in a sachet. When you have a headache, you take your amen Panadol, and it goes. You have diabetes, you take something that is reducing the sugar for you. That is an amen right there in a sachet.
Amen doesn't have
Just
to be
pray. Thank you. Just pray on the drug and take it. And maybe one day you might need necessarily. I told you now, there are testimonies of people that started and they didn't need a drug. Last because the body learned how to handle it. That is a miracle right there, isn't it? You now see them raising their hands. That doctor, they make us look like we are one wicked person. I say, you're not the average doctor. When they want to draw, if they are drawing pictures for dictionary for children to know what is. I say, doctor, you see us, we got a knife. We after your life.
But they will say that they pray to God, they should never go to the hospital.
Imagine. I say we are one, like we're criminals. I say, at the end of the police, they should also put knife on the let us know we are.
It will never get to that. It will never get to that.
So please, your average doctor, not just the police, are your friends. We're not after just your money. We are about your future, and your future is not just you. It's your father, it's your friends, it's your children. Because I tell women, imagine you came here pregnant with a child and everybody's waiting for you, and then we're not going out to say we are sorry.
No.
No, you think that's great news for us? Some of us even cry before we go to spread the news. I remember the first time as a house officer, after doing you're not going anywhere, in the name of Jesus, Allah, person can't die. And everybody now looked at me. I was like, no. They're like, yes. Go and break the news. I'm like, I say, you know that macaroni dance? There, macaroni they do. I swear that day I do. Everybody was like, what are you doing? I say, people don't go understand. You're like, oh, well, that's the house of it. That's the job of a house officer. Go and learn how to talk to your patient. Jesus. When I now went outside, look at people smiling. I'm like, hey. See, that is when I now respected my career. Because I had to smile back and tell them that, can I take a moment of your time? Who is the eldest person here? They pointed to the guy. And I took him aside. I don't even know where that wisdom came from. I'm like, sir, I picked the eldest because I know you act more matured. Can I trust you to do that? He said, yes. I'm sad to tell you this. We lost so. Wow. The man just nodded. So the others thought it was also good news because he played along. I'm taking you out because I don't know who I'm supposed to tell this to. I know there are different people that will know how to handle it like you have. Can you help me tell the others? And then for the wife, I don't think I want to tell her now, because I'm looking at her face. I don't want to wipe that smile off yet. And he now said, you're so intelligent. Did you think of another profession before medicine? And I posted into laughter. And I said, this is what I've come to tell you. I hope you take it in good faith. And he shook my hands. And in the other hand, he put something inside my pocket.
Okay.
For bad news.
Bad
I'll
news.
come back to your profession. I'm very good with that. But thanks so much, Dr.
Thank you
Lam,
so
for
very
this.
much
We
for being
appreciate
part
you,
of
and,
this show.
happy birthday in advance to you.
Oh, I see I said gifts.
Please send in gifts.
Send them gifts.
I have address, I have phone number.
Thank you so
Well, thanks so
very
much. Really
much.
appreciate.
Thank you.
Really appreciate. This, I hope you learned a lot from this. And like she said, please, you have to do your checkups. Check. Go out there, find out, and don't just let it be assumptions, or maybe you're just trying to, self-medicate yourself, or keeping secrets you shouldn't keep, which is something very important. I think we'll do our emphasis immediately after sports, but then let me leave you to enjoy sport. After sport, we come back on Daybreak Africa, and yeah, we draw our conclusions. So please stay with us. We'll be right back.
Welcome back from sports, and I hope you guys enjoyed and learned a lot from the guest segment that we had earlier. Of course, because I really do learn, unlearn, and relearn. And of course, I know you did.
I did. In fact, now I'm even more hungry. Maybe I will have to go to places, especially religious houses. Tell your people.
Give them.
Thankfully, okay, I have a bit of roots in Islam, and I'm a practicing Christian.
Okay.
Like, let's go out and tell people, please, I beg. I know, yes, faith is great. God can heal all things.
I believe in miracles, as I always
Part
say.
of the miracle of God is medicine. Health workers are part of it.
It comes from herb, natural herb.
I watched an apostle preach recently, and was commenting on the young lady who, after he finished preaching, came to meet him and said, "Sir, I feel guilty. I've not been praying like I used to pray before I got my job and all those kind of things." And the man looked at her, said, "How many hours do you used to pray before?" He said, I pray for before I got my job, before I started my profession, I used to pray all through the night. I used to pray 6 hours, 7 hours." I said, "Oh, wow,
because you don't get job."
That's good. That's good. So now, how many hours do you pray? Yeah, I just pray maybe just 1 hour. In fact, sometimes I'm just too tired to pray. I just wake up and just do 30 minutes, or maybe 20 minutes, or maybe 10 minutes.
Okay.
And after that, I go, say, okay. And after that, where do you go to? Say, I go to office and you work all day. Yes, I work all day, and you go back to home at night. Yes, and you have to rest from work that day, and you are feeling guilty that you did not pray, and all that. And he told her, "Do you know that the prayers you've prayed then are answered now, because you are now an answer to multiple people's prayers."
Exactly.
And he said something to her that really hit me. He said, "The day you will know that God is now using you to answer people's prayers is that someone is about to die, and what they need is what you practice." And you turned up to that person and you attended to the person's problem.
Saved a life.
You've just saved a life.
That's wisdom.
That means you have answered somebody's prayers. You are an answer to somebody's prayers. So if you see a medical doctor today, or you see an health professional, or any professional out there, whether law, the day you will know that you need to value lawyers is when you have a case that will make you sleep 2 days in prison and understand.
Then you will understand what the profession entails.
Been there for years, and you now finally find a lawyer that can just say, "Sir, he did not do it," and can prove your case honestly. You will discover that you are an answer to somebody's prayers. So the truth about faith is that faith does not deny the mountain. Brother, take your health seriously. Take your health. And this
Very
issue of
serious.
I don't have this thing and you have it. You are
hiding it. Very dangerous.
Me, I support government even screening preachings of some people. Like, how will you say that people should not use drugs? Like, what?
Oh, good. It's just well.
It's well, though, because
it's well.
Everything she said, honestly, really thrilled me. Like, look at what she said about hepatitis. Like, even
showing love to your spouse.
To somebody. So now I've discovered, if you enter, don't me.
My uncle was telling me a couple of months ago that he has stopped kissing his wife. Me, I was like, what happened? He said, you don't know what is going on. Don't you know that? Your wife will feel bad. It's like, even if she
No, you
feels
see,
bad.
when it comes to
don't-
wife, when it comes to wife now, there's hardly anything you can do about it, because sometimes two of
But
you
you
are
have to
there.
limit it. to
No,
some
they are
extent.
what limitation do you want to limit? Are you married? No.
Oh, thank you so very much for reminding me that I'm unmarried.
Limit.
Thank you for reminding
I will
me.
say you should not kiss around the first instance if
Thank
you
you
not search.
for reminding me that
Don't
I'm
worry, get
married.
married one day. It's at least it's a Thursday, so you can.
Thank you. Thank you so very much.
Yeah.
Thank
Well, thank you in the actual sense, but I think the message is passed in the actual sense. So definitely, please take cognizance of your health. Take cognizance. It's very important.
Yeah.
It's very, very important. But we'll meet tomorrow on Daybreak Africa. My name still remains Ikhonede.
And my name is Miracle Odunayo.
Bye, guys.